breastfeeding or postnatal care with breastfeeding techniques. But what is this postnatal care? And we all know the knowledge of gestational period, right? From conceive till delivery, we got to know everything knowledge about that. But what about after delivery? How we should care, how we should care the woman, and how we should care the baby. What is this postnatal care? We will see today. So objectives are nothing but what is the main aim of postnatal care? Ensure maternal and newborn health. Maternal here is nothing but newly delivered woman, and newborn is newborn baby. Caring both, taking care of a woman after delivery and about the newborn baby is postnatal care. Detect and manage complications. We have many more complications after delivery. So what is that complication? To detect it and to manage how, like to prevent the extra risk or extra ill health of a future baby, how we should prevent it, how we should manage it, we will get to know. Provide emotional and psychological support. Why emotional and psychological support? Because as the mother will be, especially in first time mother, she will be a new in new world with new responsibilities, new care, and also her physically all the hormonal imbalances will be taken place, all the organ changes will be taken place. So due to this, she will be having many mood swings, frustration, depression. In such, especially in these conditions, many women will go for postnatal depression only. So managing them or providing support for them, we'll get to know. Educate on newborn care and breastfeeding. Obviously, as newborn is like they have new responsibility about it, they will not be knowing that how to take care, what to do, what not to do. So educating about this, these all points are about the postnatal care. Immediate postnatal care, first 24 hours. Immediate. Now delivery happened and newborn baby came into our hand. Immediately within 24 hours, what all points we should know exactly to do? That is, first thing, monitoring vital signs of mother and baby. Vital signs here are nothing but the main respiratory issues, like the main points to manage a health. Maybe in maternal, that is in woman, about the bleeding or about her health condition or about the breast, like production of breast milk, these all. And special vital signs according to medical field is blood pressure, heart rate, and the respiratory rate. These all will come under vital signs. When we come for newborn, obviously after delivery, the first 1 minute, according to our medical term, especially the first 1 minute when newborn baby comes out is known as golden minute. Within this minute, if baby had cry and respiration, then the baby will be absolutely normal. But within this minute, if baby didn't had a respiration and cardiovascular system functioning, then then the baby will go to further complications, like maybe baby may go into distress, may go into brain hemorrhage, many other complications are there. So within a minute, baby should cry immediately. You all may be here when we go if any, by taking any health issues in a children, if we go to pediatrician, especially within 6 months or within 1 year, if we are taking a baby to a pediatrician, first question they will ask is whether baby had cried immediately after birth. They will ask, right? So because that is the first sign that baby is normal. If baby cried immediately after birth, then baby is out of danger. That we have to monitor. Skin to skin contact and breastfeeding initiation. Breastfeeding within 2 hours after delivery, though mother had lactation, mother had milk or not, mother is getting milk or not, the baby should be given to suck a nipple. Within 2 hours, the baby should be given. When baby and mother have skin to skin touch, if whatever ejection of breast milk is there will start. So what our parents or any people will do, like they will press by their own, they will press the breast and see if milk is coming, then only they will give newborn, or else they will say that breast milk is not coming, so go for formula milk. Nowadays it's a style, right? Actually they should not do that. Whether milk is coming out or not, you should give a baby nipple in a mouth, so that baby also will get to know the sucking reflex, and also by touching skin to skin and by touching the baby's mouth to a nipple, milk will start coming. So we should ensure them that within 2 hours after delivery, you should give a nipple in baby's mouth. As babies goes on sucks the nipple, the milk will start coming. Uterine involution and bleeding assessment. Because immediately after delivery we got to know that uterus shape will be changed and bleeding will start in a woman, right? These 9 months she will not be having any menstruation cycle, but immediately after delivery she will start to bleed. So within 24 hours, whether she is stable, whether she is getting more bleeding, whether she is passing a clots, these all doctor should ask her, or she should be taken care. Neonatal screening and immunization. Immediately after delivery, in some hospitals on same day they will give, in some hospitals within a month they will give. BCG vaccine they will give on, sorry, left arm of a newborn they will give BCG vaccine. But it depends on the hospitals. Some will give on a birthday only, some hospitals will give on discharge day, some hospitals will advise them to give within month, depends on their practice, but within a month the baby should have BCG vaccine on left arm. And screening, obviously that baby is crying, and also main thing is like baby should pass urine within 12 hours after birth, and baby should pass the meconium, the first stool, first motion of a newborn is known as meconium. It should be passed within 24 hours after delivery. So these all points we should notice whether the baby and mother are in normal condition or not within 24 hours after delivery. Maternal postnatal care. Maternal here, nothing but as I mentioned, the delivered woman is known as maternal. Physical recovery. As we know, uterus, perineum, or C-section wound care. If woman had a C-section, obviously she will be having C-section wound care. Or in vaginal delivery, some will be having episiotomy. Episiotomy here is nothing but some part of the vagina will be cutted in front so that baby can come out easily. After baby coming out, they will stitch it. So if they are having normal delivery, they'll be having vaginal stitches. That care should be taken. Nutrition and hydration. This is a special point because many people, especially in Karnataka, I don't know about other places, especially in Karnataka, they have big myth that after delivery, the woman should not have more water. She will, if she had more water, baby will get stomach pain, they will say. Actually, it's a big myth. How much water intake the delivered woman will have, that much increased production of breast milk she will have. She should be hydrated, not only for breast milk, even by keeping hydration, her all toxins, whatever toxins are there in the body after delivery, whatever changes are there, it will be flushed out through urine and feces. And she will have a correct bleeding if she is well hydrated. So these all are benefits. Actually, in olden days, why they were not giving more water for newly delivered women is, as we all know, they were not having washrooms in home, right? They used to go out of the place, out of the city or out of the village to pass the motions, everything, right? So if she have more water and if she have all sorts of food, she will get motions, and it is difficult to newly delivered woman to go so far for washrooms and all, bathrooms and all. So they were giving in a limited form, everything. It may be food, it may be water. They were giving in a limited form, but not because of any other condition. Actually, it's a big myth. After delivery, the woman should be having the woman should have fully hydration, more amount of water, and also nutrition. About nutrition also same thing, but this I agree, she can't have all sorts of food as we have. There is a reason for it, because as from after delivery, as she will be breastfeeding, whatever she takes food, directly or indirectly, it will go to a newborn baby. And these all spicy foods and sour foods, more fried foods, these all are contraindicated in newborn because they can't adjust these type of foods in initial way. So for that reason, they will say to not to have over spicy, over sour, but all sorts of food she can have. Not like usually our grandmothers, they will give only white rice for them nearly for 1 month. What she will get nutrition in that white rice? Nothing she will get. And that same nothing nutrition, only carbohydrate and glucose will be moved to a newborn, right? Even newborn will not be having any nutrition, and even a delivered woman. But nowadays, our women are fully changed. Like immediately after delivery, within a week, they will start roaming. That is also wrong, not that much. But overall shed rasas of nutrition in a limited form they can have. One thing, it will get effects for newborn stomach, and after delivery has their like what to say, dosha vitiation will be happened, everything will be happened. So even their GIT can't adjust all spicy foods, so they can have in a limited form, but all sorts of food they can have, especially the like proteins which increases the vata dosha in a body, that should be avoided, I agree, because after delivery usually in woman's body vata dosha will be increased. So because of that reason, if she had again increasing vata, she can have complications like body pain, joints pain especially, or constipation. These all she can have, she will have. So because of that reason, she can avoid protein contents, limited form she can have. And about mental health, as I informed, due to hormonal imbalances, she'll be having mood swings, frustration, depression, everything. Because till pregnancy, there will be increased progesterone and estrogen level. We got to know to maintain a pregnancy, right? Immediately after delivery, that this increased one, they will get fluctuated. These all hormones, it takes time to come to a normal position. So if till they come to a normal position, she will be having fluctuation of moods and minds. So she should be maintained, or she should be supported physically as well as mentally. One thing is that reason, and another thing, as I said earlier, like new responsibility came to her, so she will be having disturbed lifestyle, right? So if she get any support, she will be calm and cool. And last point is contraceptive contraception counseling. Why we need contraception counseling is, as we know, after delivery, since like a few months, or for a few women till 1 year, they will not get menstruation cycle. After delivery, the bleeding will start, depends on their body prakriti, like for few days, or for some till 20 days they will get bleeding continuously, and when it stops, for some women even they will get again next month only menstruation cycle will start. But for some women till 6 months they will not get cycle. For some women till 1 year they will not get cycle, but only they will not get menstruation bleeding. Ovulation process will be in a regular way. So in these condition, if they had intimacy, then there will be high chances of getting pregnant again. So already her body is all disturbed. It's still not ready to routine works. And if she conceive again, it will hamper her own body also, and it will hamper breast milk also, and it will hamper the nutrition of newborn baby also, right? So because of that reason, we should counsel them about the contraceptions, how we can avoid pregnancy. So that was about the maternal, about the woman. Newborn postnatal care is breastfeeding and nutrition. Again, breastfeeding is within 2 hours. She should start giving like nipples to a newborn mouth. And after that, when she gets breast milk, for every 2 hours, the baby should be fed. Especially till 3 months of a newborns after delivery. For every 2 hours, compulsorily, the baby should be fed. But here again, many complications are there. Some babies may not get up after 2 hours, till 3, 4 hours, they will be sleeping. At that condition, even after 2 to 2.5 hours, the mother should wake them up and they should feed. And in another condition, the babies will be crying, though they fed tummy full. Again, babies will be crying within half an hour, within 1 hour. That also should not be done. If after tummy full, usually babies won't get hungry till 2 hours. If they are crying within half an hour, within 1 hour, then there may be some other reasons. Maybe like colic pain, maybe bedding problem, maybe baby needs skin to skin touch, or many other reasons we have. So rule out for that, and you can divert the baby. And about nutrition, as I said, like every all sorts of nutritious diet the mother should take, because has a like pregnant, even in pregnancy also, even after delivery also, whatever a plate of food the mother is having, it will be divided into 3 parts after absorption in a body. One part will go to fetus development in pregnancy, and one part will go to production of breast milk, and one part will be for pregnant women. After delivery, it will be divided into two. That is, as newborn came out, one part will go to production of breast milk and one part will be for woman's body. So whatever nutritious she is taking, all will be moved to a newborn. So she should enroll whether she is having all sorts of nutrition diet or not. And hygiene and umbilical cord care. Hygiene, obviously, as newborns are new to this environment, they'll be having, they will be very sensitive. So we should maintain very much hygiene surrounding them, within their room, while touching them, within their bed, everything should be maintained purely hygiene. And about umbilical cord, as we all saw, newborns, how the umbilical cord will be, like this much length will be, and nowadays, before it was thread, nowadays they are giving, like they will keep umbilical cord clamp to a newborns, right? After 7 to 8 days, it will dry up itself and it will fall down. And later, like us umbilicals, the newborn will be having. But within the 7 days, we should maintain very much hygiene surrounding the umbilical cord. If we are keeping wet, watery wet, or some will apply powders, like facial powders to whole body. So if any powder part is remaining on umbilical, it may get into infection and it may cause many complications for newborn. So especially the 7 to 8 days till it's dry up, we should maintain hygiene surrounding the umbilical cord. Monitoring jaundice and infection. This jaundice, again, in newborns, we have two forms of jaundice: pathological jaundice and physiological jaundice. This physiological jaundice is very common in newborns till 15 days. But when it should get, today the baby came out, today they had a delivery. After 24 hours of delivery, if the baby had jaundice within 7 weeks, from 2nd day to 7th day, if baby got jaundice, then obviously it will be physiological jaundice. It is very common because their liver functioning will not be started still. After 15 days, the liver will start to function in a regular way. So after 15 days, it will reduce. It's common. But if any baby had jaundice within 24 hours or after 7 days, if jaundice is detected, then it will come under pathological jaundice. That for that jaundice, we have many other reasons, complications, everything. So it should be ruled out. And infections, as I said, babies are very sensitive. We should maintain very hygiene part so that any infection is prevented to our newborns. And immunization schedule has, immediately after delivery, while discharging a newborn, the hospital people will give a immunization schedule chart only, right? But nowadays they are giving many like lengthy immunization schedule. It's not mandatory. In whole that list, few will be like mandatory one. That mandatory immunization, if they had, that's enough. But compulsorily, whatever mandatory immunization schedules are there, that should be done to prevent further health issues. Postnatal complications and management. Complications, what all we may get, like in maternal, like that is in women, infections, hemorrhage, and depression. As we already discussed, infections are due to her, maybe any unhygienic condition happened during delivery or after delivery. If she is not maintaining hygiene, then she may get hemorrhagic. Like if some women are having heavy flow after delivery, that they are getting into fatigue, then they should go for enrollment or like a visitation for doctor. And depression due to hormonal imbalances. Common newborn complications, as I said, jaundice, infections, and feeding difficulties. If the people didn't practice newborns to suck a nipple, then obviously the baby will not get the sucking reflex and they will not suck. One thing. In another thing, if they are premature babies, if they had delivery within within 36 weeks, then it will come under premature delivery, and those babies will not be having sucking reflex still. So they will get feeding difficulties, and in vice versa, in other conditions, if the mother is not having breast milk being started still, then in such condition, again, another forms of feedings we should go. When to seek medical help? Now we got to know what all complications we may get in after postnatal, right? So if these all are, we can prevent. If we know, we can prevent it. If we are not able to prevent, then we had any health issues, immediately we should seek a doctor. Postnatal care is crucial for both mother and baby's well-being. Regular checkups and early detection of complications is necessary. Emotional and psychological support is essential, even for both. It may be for newborn and it may be for woman, newborn, like newly delivered woman. Both should have, want emotional and psychological support. So till now, it was a postnatal care. So further, especially about breastfeeding, as I said, within 2 hours, the baby should be given for breast milk. Baby should be given nipple to suck, so that even baby will get the reflexes, sucking reflex, and even by sucking, the mother will start producing breast milk. Or already it is produced inside from mammary glands. It will start to excrete out. And benefits for baby: nutrition, immunity, and bonding. Everything. Whole and soul babies is on breast milk only, right? Especially till 6 months, baby should be exclusively breastfeeding. No any other thing, except in peak summer, we will advise to give distilled water. Rather than that, till 6 months, no any other feeds except breast milk. So whole life, it may be nutrition, it may be immunity, it may be bonding with mother, everything whole and soul is newborns is breast milk only. Benefit, even this breastfeeding have some benefits for even mothers also. Like if she is regularly breastfeeding a baby, she will get balanced hormonal imbalance whichever she had in a body. It will help her in weight loss, because as I said, one part will go to breast milk production of our food, and reduce risk of diseases. Due by exclusively breastfeeding, it can avoid the cancers in women especially, and she can avoid the reproductive organ difficulties or diseases. No warm water, ma'am. That's what I said. In peak summer, that too, how it is, especially during, like in Karnataka, because I don't know about other places how will be climate. So I am specifying Karnataka. Especially in April or May, if you had a delivery, it will be a peak summer, right? So that temperature, though we have so much water also, it will not be sufficient for our own body. So at that condition, we will advise them to give distilled water, which we get in medicals. That too, 10 ml distilled water in whole 24 hours. We will advise for newborns. If they have any complaints of dehydration, like baby is not passing urine, or if mother complains that she had burning micturition, then we will advise, or else no any extra thing except breast milk till 6 months. So from that time, I'm saying within 2 hours, you should give breast nipples to a baby. But many new mothers will not be having idea how to feed, how to give nipple, everything, right? So see here, if you give a nipple like this, obviously baby can't take it in mouth only, and how it will suck. It will be difficult for newborn also to suck the milk, and even it's difficult, or the mother will get pain if the baby is sucking only nipple. So again, it will cause many complications. So correct position is this: almost full areola should be inside the mouth of a baby. And see here, like lower lip, how it is hanging outside of a newborn baby, it should be hanged out, so that whole nipple will be covered for a newborn baby's mouth, so that baby can suck easily. And even by this, newborn mother also will not get pain and cracked nipples. Especially many new mothers we will see, they will come with the complaint like, baby, I'm not able to feed a baby because I have milk, but I'm having cracked nipple. So if baby is sucking a nipple, I'm getting pain, so I'm not able to feed them. Actually, that will be because of this wrong latching. If they give wrong latching like this, then it will cause side effects, and even baby can't swallow, suck, and even mothers will also get pain. So this is the right position to latch a nipple for newborn. This is wrong one. And these all are different positions by which all positions we can feed a baby. Cradle position is nothing but has, like cradle, taking a baby in both hands like a cradle and giving support and feeding. The second one is cross cradle position, as they showed, like cross one. And football hold. Football hold is nothing but, if we are holding a football, how we will hold? By single hand, like this we will hold, right? So same thing she is holding here with one hand. laid back position. By lying back, they can feed a baby. Side lying position. Side lying by elevating themselves up, feeding baby. But though we have these all positions to feed a baby, my advice is not to feed a baby in lying position. Like first thing they can follow, like cradle, cross cradle, or football. That too, how the baby's nose, baby's head should be elevated up so that baby's nose will not be pressed, and while swallowing, the baby will can swallow easily. In lying positions, what will happen? One thing, it will not be a correct position to a baby. Sometimes nose will be pressed, and another thing, while lying, it can go to aspiration, like it can aspirate in lungs, or it can move to the ducts of a ear, so that baby will have ear infections due to this. So it's better to avoid lying positions. Lying positions, they are like fully, they like 100%, I'll advise to feed in sitting position by taking a baby in a lap. So proper position of baby while breastfeeding includes support whole of a baby's body, ensure baby's head, neck, back are in same plane, because when head, neck and back are in same plane, if we swallow, for example, now only think we are eating anything, I'm sitting straight, or like sitting position, if I'm eating, I can swallow it easily and it will go to stomach easily. That only if I am lying and eating, or I am in different position and I'm eating, then obviously I can't swallow it easily, right? Same in a babies also. Entire baby's body should face mother. One thing here, bonding will increase. Another thing, the baby will be comfortable in that position, like tilted position, the baby will be comfortable. Baby's abdomen touches the mother's abdomen. That is the correct way. Like if I am blindly, I'm saying, keep baby straight, keep baby straight. Some mothers will not get, right? So face baby's body towards the mother's body fully, and touch the abdomen of a baby to a mother's abdomen. That will be a exact position of breastfeeding. And here what they are doing this, actually after feed, the next step comes is burping. Burping here is nothing but, has they will be sucking and swallowing. They will be sucking and swallowing. While sucking and swallowing, they will take the air also inside. They will swallow the air also. So due to this, if we feed and if we make them to lie down, like sleep immediately, and this problem also will get in lying position. If they swallow and lie immediately, many mothers or many babies will come with the complaints like colic pain. My baby will cry in midnight very much, or my baby starts to cry in evening times continuously. Baby will be cranky. Because of this reason, immediately after breastfeeding, they should take the baby either on shoulder like this, as they showed in pic, or they can make the baby to sit on their lap with the support like this, and they should rub on baby's back, so that when they rub baby's back, whatever air swallowed while feeding, the air will come out with, like what like after having food we will get the regurgitate, right? Like we will get the air out. In same way, the babies will remove whatever air swallowed out, so that colic pain or vomitings, regurgitation vomitings will not get in newborns. This is compulsory after every feed. For example, till 3 months, we are feeding a baby for every 2 hours. Compulsorily after 2 hours, like after feed, they should be taken straight for 5 minutes, so that they will remove the air out and baby will not get colic pains. One thing. Another thing to add in breastfeeding is, usually our elders will advise, don't feed continuously one breast only, change the breast. Whenever you're feeding, give one breast for 5 seconds or 10 seconds, and change the breast, and another breast, give 5 to 10 seconds. You should not do that. For example, now every 2 hours we are feeding. Once I should empty all my full breast once. If baby is not full, then we can remove, we can give another breast. Or else, for one feed, we should give only single whole breast, because in our breast, we have stages of breast milk. Initially, first stage of milk will be having only water content, and second stage of milk will be having thickness, whatever cholesterol we have. So if you feed on half of breast for every, if you change, goes on changing the breast, their only thirst will be subsided, but not the hunger. Because of this reason also, like for every half an hour, 1 hour, the baby will start to cry, because baby's hunger is not subsided there. Only thirst is subsided. So if you give one breast for 5 seconds, baby's thirst is subsided. Still baby's hunger is not subsided because colostrum is still behind, right? If you change the breast, again only thirst will be subsided, not the hunger. So because of this reason, baby will start to cry. That only if you feed whole breast once, then baby's thirst, hunger, everything, nutrition, everything will be subsided, so that baby will sleep aramse for next 2 to 3 hours. So obviously, as I mentioned, tips for successful breastfeeding: ensure a comfortable position. First thing, feed on demand. As I said, baby may be crying for other reasons also. Rule out that, but for every feed, don't for every cry, don't feed a baby. Stay hydrated and maintain a healthy diet. Seek help if experiencing pain or difficulties. Obviously, like in first time mother, they will feel every step is painful only. So if anyone elders are there to guide, it's better. Caring for your baby in the first weeks after birth includes responding to your baby's signals, usually obviously babies can't speak, right? Whatever we should understand by their signals only. So as I said, baby is like, if they are feeding continuously lying position, baby maybe had ear infection. But how we should get to know? Baby will be cranky and crying, one thing, and another thing, baby will be touching ears always. Or if baby is having colic pain, baby will be touching abdomen and crying. And in other conditions, like especially in colic pain, babies will cry in evening hours and baby will cry in a midnights. Suddenly baby is sleeping normally, and suddenly baby get up and cries very much, very cranky. Baby will become very cranky. These are signals we should understand, so that it will be easy to maintain a newborns. Keeping your baby secure and safe. Obviously, all parents will do it. Exclusive breastfeeding, especially till 6 months. Getting your baby vaccinated, has schedules are there. Immediately after birth, after after 4 weeks, after 6 weeks, after 10 weeks, after 14 weeks, some according to weeks we have that one. Having your baby's health and development checked, especially weight. Like whatever birth weight is there of a baby, it should be doubled when baby completes 5 months, and it should be tripled when baby completes 1 year. For example, if baby is 2.5 kg at birth, after completion of 5 months of age, the baby should be 5 kg, and after completion of 1 year, the baby should be nearly 7 to 8 kg. So this is a classical, practically gaining weight. And again, all babies are not same. If one baby is gaining half of kg every month, it's not compulsory that every baby should gain half of kg every month. It depends on baby's prakriti, baby's parents' prakriti, and even on depends on the feed whatever we are giving. Having your baby's health and development checked, looking after your own health and well-being. Obviously, as much as we are taking care of a newborn, that much care we need to give for delivered women also. Whatever changes are going on in a newborn, its double changes are going on in a newly delivered woman. So only our elders fixed like 3 to 5 months she should be fully in bed rest, not doing any works. But nowadays, as we are working women, as we are, our lifestyle is changed. Till 5 months, no one will take rest after delivery. But minimum 30 to 45 days rest is must and should for newly delivered women. So what are Ayurveda, especially Ayurveda says about the postnatal care is, do's, whatever we can do, massage yourself with Vatahara oil. As already I mentioned, after delivery, the Vata dosha will be vitiated or will be increased in delivered women. So that should be reduced. That should be expelled out. So because of that reason only, Vata means dryness. She will get dryness, she will get pain. Because of that reason, due to Vatara oils, she should be massaged and she should be given warm water bath. And keep your breast and perineum clean, because as that stage will be very sensitive, she may get infections frequently, so that hygiene should be maintained. Urinate every 5 hours. it should not be withheld. It may be motion or it may be urine. It should not be withheld. It will be having chances of UTI, urinary tract infections or infections. And breastfeed the baby properly. As much as you can, try to breastfeed a baby for every 2 hours. Breastfeeding have many other health benefits for women's body also with the newborns benefits. But nowadays, like women, especially like due to their cosmetics or due to their other hectic life, they will avoid breastfeeding and they will give hormone like formula milks for a newborns. That should be avoided. As much they will give breast milk, it will be very beneficial for their body also and even for newborn babies also. And some points which should be avoided during postnatal: avoid consuming food irregularly. One thing, regular pattern should be, and it should be included with all shed rasas in a limited form. Avoid intaking stale or cold food, as there will be vata dosha vitiated in a body. It may have side effects if they have cold foods. So usually they will prefer warm foods for a postnatal care. Do not retain urine on feces, as we discussed. Do not indulge in exercises or sexual intercourse. Now, again, whatever these exercises and sexual intercourses, when they should start after delivery depends on how they delivered. If it's normal delivery without any complication, after 45 days they can move to routine activities. If it is C-section, usually they will advise to take rest for 3 months. Again, it depends on the body prakriti and it varies body to body. They can consult their gynecologist and they can move to their routine activities. So this was about the postnatal care and about